So managing the potential complications or side effects of tapering, first of all, one of the critical things is to do the smallest possible dosing adjustments, as small as possible reductions, and spread them over a reasonable time so that the patient has a chance to get used to it. Now, practically speaking, for me, it's meant that I rarely do more than a 5% reduction of the entire daily dose at a time. So if a patient is on 100 milligrams morphine equivalent, for example, we'll reduce the dose by 5 milligrams per day. Not 5 milligrams per dose, but 5 milligrams out of the whole daily dose. For larger doses, the dosing reduction may be similarly just scaled up to the size of the dose, but 5% of the daily dose. And then some people do seem to be able to tolerate reductions every week, but often that's not the case. And so when I set out to do this, I usually ask them to reduce once a month. So if they're on 100 milligrams a day, I'll reduce them by 5 milligrams down to 95 milligrams a day and keep them at 95 milligrams for the rest of the month, and then make the next dose change. And that usually first of all, the reduction is small enough that they tend not to get symptoms like withdrawal symptoms like nausea. They often do feel a slight increase in pain, and that usually has subsided within a week to 2 weeks, and they get back to in most cases, they get back to perceiving their pain much the same level as they did before we reduced the dose. And then we go on about the next dose. So that obviously that means 5% once a month. That's 20 months to bring somebody down, from whatever dose they're at down to 0, if that ends up being the target. Often it's not the target. So often you'll bring them down, might come down in a month, might come down the second month, and then they say, look, I'm quite uncomfortable, this is a problem, it's getting to the point where it almost keeps me from being able to do my work, or I'm staying awake at night now. And at that point, we'll just pause and wait and see how things settle down.